Cardiomegaly. Final answer. Enlargement of the heart. From the chest x-ray, the cardiologist was able to determine the patient had cardiomegaly. Rhinorrhea. Final answer. Nasal discharge. Timmy presented to the pediatrician with a sore throat and rhinorrhea. The pediatrician's differential diagnosis included a cold or allergies. Hemostasis. Final answer. The stopping of blood flow. When Mrs. Smith got to the ER, the doctor noticed that her cut had already started hemostasis, so her blood loss had slowed. Bronchoscopy. Final answer. A visual examination procedure of the airways. Due to the chest x-rays and the patient's history of smoking, a bronchoscopy was ordered to examine his airways. Tachypnea. Final answer. Abnormally rapid breathing. The patient reported to her doctor a feeling of a tight chest. Her doctor saw that she was exhibiting tachypnea. Start over the sentence. The patient reported to her doctor a feeling of a tight chest. Her doctor saw that she was exhibiting tachypnea and tachycardia when listening to her heart and lungs. The doctor diagnosed a panic attack. Hepatomegaly. Final answer. Enlargement of the liver. Concerned with the patient's jaundiced skin, the doctor palpated the abdomen to check for hepatomegaly. Pancreatoma. Final answer. Tumor in the pancreas. After the MRI, the doctor noticed a pancreatoma in the patient's pancreas. A biopsy was ordered to make sure it wasn't malignant. Esophagoscopy. No. Esophagoscopy. Esophagoscopy. Final answer. A visual examination procedure of the esophagus. Mrs. Smith complains of difficulty swallowing due to her history of throat cancer, and esophagoscopy was ordered to make sure the cancer hadn't spread to the esophagus. Gastroenteritis. Final answer. Inflammation of the stomach and intestines. Timmy came to the ER. His mother said he had diarrhea and had been vomiting the past 2 days. His abdomen was tender when palpated. Timmy was diagnosed with gastroenteritis. Rectocele. Final answer. Hernia of the rectum into the vagina. Mrs. Smith complained of vaginal rectal pain. A vaginal exam was ordered and the rectocele was discovered in her vagina. Gingivectomy. Final answer. Removal of the gums. The oral surgeon performed a gingivectomy on the patient's gums because of his severe oral cancer. Pancreatectomy. Pancreatectomy. Final answer. Removal of the pancreas. With the discovery of the pancreatoma, a pancreatectomy was scheduled so it could be removed. Ascites. Final answer. Excessive fluid buildup in the abdomen. After the accident, Mr. Johnson came to the ER with severe ascites. There was concern for internal bleeding and severe organ damage. Hematochezia. Final answer. Blood in the stool. When Mrs. Smith came to the ER complaining of severe abdominal pain, she complained of hematochezia and severe constipation. Cerebrotomy. Final answer. Surgical incision into the brain. In order to remove the mass in the brain, the surgeon performed a cerebrotomy. Narcolepsy. Final answer. A disease of uncontrollable sudden sleepiness. Timmy had been suddenly falling asleep at school and home despite having adequate sleep. Narcolepsy was added to his differential diagnosis. Pneumocentesis. Final answer. Surgical puncture of the lung. The patient had severe fluid buildup in his lungs. A pneumocentesis was performed to allow the fluid to drain. Ischemia. Final answer. Blockage of blood flow to an organ. The patient was experiencing renal ischemia, and therefore his kidneys were unable to filter his blood and produce urine. Brute, final answer. Audible blood turbulence in an artery. When osculating the patient, When osculating the patient, the doctor noticed a notable brute. The patient was referred to a cardiologist for further investigation. Splenorexis, final answer. Rupture of the spleen. The patient was rushed to the ER after the car accident. An MRI showed evidence of splenorexis, and the patient was scheduled for emergency surgery. Adipocyte, final answer. A fat cell. The lab worker noted the presence of adipocytes in the tissue sample. Strabismus, final answer. A condition where the eyes deviate when looking at the same object. The optician noticed strabismus when Timmy tried to focus on her finger. Esotropia, final answer. Inward turning of the eye towards the nose. Upon further examination of Timmy's eyes, the optician noted esotropia in Timmy's left eye. Gastroparesia. Gastroparesia, final answer. Paralysis of the stomach. There was concern that a nerve was accidentally severed after the surgery on the patient's abdomen. The patient was experiencing gastroparesia. Gastroparesia, final answer. Paralysis of the stomach. There was concern that a nerve was accidentally severed after the surgery on the patient's abdomen. The patient was experiencing gastroparesia. Meningocele, final answer. Hernia of the meninges. Because of the patient's head injury, an MRI was ordered. The MRI showed a meningocele in the front portion of the patient's head. Oliguria, final answer. Production of abnormally small amounts of urine. The patient complained of headaches, kidney pain, and oliguria. The doctor diagnosed extreme dehydration and ordered IV fluids for the patient. Orchiotomy, final answer. Incision into the testicle. In order to correct the patient's testicular torsion, the surgeon had to perform an orchiotomy. Dyspnea, final answer. Difficulty breathing. Timmy experienced dyspnea when he overexerted himself. Timmy was diagnosed with asthma after some breathing tests were performed. Edentulous, final answer. Lacking teeth. The patient needed all of their teeth removed. Since the patient was now edentulous, they needed to be fitted for dentures. Thrombocytopenia, final answer. Deficiency in the number of platelets in the blood. When the lab results came back, the doctor noted the patient was experiencing thrombocytopenia, which explained why they bled so much.